holistic healthcare, homeopathy, naturopathy, acupuncture, hypnotherapy, and other alternative forms of healthcare for overall vitality and well-being. From the Renaissance Health Center in Las Vegas, it's the Healing the Whole Body podcast.
Welcome. We finally have Dr. Pfau in the house, you guys. I know you've all been anxiously waiting to hear from him, and we're going to have some golden nuggets today. Today, we're going to talk about the most common health issues that Dr. Pfau sees, and what are some of those common health issues that you're seeing when patients are coming in?
Well, probably the most common is fatigue, followed by sleep issues, insomnia. Digestive issues are also very common, and then autoimmune diseases.
Okay. And what are you finding they have things in common with each other?
I would say the most common underlying issue or cause for these symptoms is anxiety and stress.
Interesting. Well, I mean, I have an autoimmune disease, and definitely stress triggers it for sure. And is that what everyone's experiencing then? Does everyone have anxiety and stress?
Not everyone. It really depends on our genetic predisposition. Some people can go through life and not experience any anxiety. Other people are on the opposite end of the spectrum in that they're always stressed, no matter what's going on in their life.
Mm-hmm. Okay. And then, so obviously you can't avoid anxiety or stress in your life. So is it the way that we're processing it, the way that we are managing it, or is it just and then it turns into a disease? Like, what is that process to where it becomes a chronic condition versus obviously we're going to experience anxiety and stress in our lives. So why does that turn into a disease or a chronic condition?
So disease, just in general, is a state of imbalance in our body. And you can kind of imagine like this is our body when it's in balance. And some people where they've got this chronic stress to their body, eventually, even though that stress might be gone, their body remains in a state of imbalance, stuck in that state. Some people might have a extremely acute experience with stress in which it throws the body out of balance, and that also will stay in a state of imbalance. Most of us, if we have experience a state of stress and that stress is gone, we can our body will realign itself in balance.
Okay. That's a really good analogy.
So it's usually a chronic underlying stress that puts our body in a state of balance, or a very strong traumatic event that will trigger that.
And so what are you seeing like with the symptoms with our bodies? How is that manifesting?
Well, in these symptoms that we originally talked about, fatigue, insomnia, digestive issues, autoimmune disease.
Mm-hmm. And so with the autoimmune disease, what is that doing? Is it weakening our immune system?
Well, stress can have really two different effects in our immune system. One, it can weaken our immune system. And a really good example, when I was in undergraduate school, trying to get straight A's so I could get admitted into medical school, chemistry was the worst subject that I had. And so I would stress before every big exam, chemistry exam. And almost invariably, after the exam was done, I would come down with a sore throat. So stress can weaken our immune system and make us more vulnerable to infections. And a lot of people, they realize this. If they're stressed out, they might get a eruption of their herpetic lesions on their mouth or canker sores due to stress that they're experiencing. And then stress can have the opposite effect on our immune system in that it can make it become hyperactive or to attack our own body, causing immune disease. In common, often patients will come in with autoimmune disease of rheumatoid arthritis, lupus, MS. And then as I question them, almost always I will find that the underlying trigger for that autoimmune disease is some sort of stress that occurred in their life.
Right. So, for example, I have psoriasis, and with that and any autoimmune disease, you've told me that you can pinpoint a particular event in someone's life where all of a sudden it starts to manifest. And for me, that was 5 years old. There was a stressful event then. And it's funny because you've told me this. And so I've met friends and people who have had autoimmune disease issues too. And I asked them, when did that start? And they can pinpoint a very traumatic event in their mind. And to some people, it might be traumatic and other people it might not be. But to them, in that particular moment, it was. Would you agree with that?
Right. And it all kind of comes back to your genetic predisposition.
And so this can also affect our sleep and our digestive tract?
Yes. For example, as I mentioned, digestive issues are very common. One of the most common ones I'm seeing more and more is GERD, where people get reflux of the gastric juices up into the esophagus, even sometimes up into their mouth, where they will taste acidic content. And it's interesting, in 2005, the Nobel Prize was awarded to two men who discovered that H. pylori was the underlying cause of gastritis and peptic ulcers. But what's interesting is that what I have found is that almost always GERD and gastritis, gastric ulcers are caused by stress and anxiety. And what this does, it weakens our stomach immune system so that this organism, H. pylori, can take hold and actually cause ulceration or gastritis.
So what is H. pylori exactly?
It's a bacterium that can cause gastric ulcers or gastritis.
Okay.
But it is allowed to do this because our immune system becomes weakened.
Mm-hmm.
And another example of digestive issues that is becoming more and more common today is leaky gut. And this is caused by a multitude of issues, but the underlying cause that I find is almost is anxiety and stress.
Mm-hmm. I was just telling you that we were talking about this with Dr. Dahani also, and how homeopathy can help with that. What are you doing for treatments for this when patients come to see you with stress and anxiety?
Number one, we need to, treat the underlying anxiety and stress.
Mm-hmm.
Because unless you do this, no matter what you do from a functional medicine point of view, it's not going to, if you do have success in healing it, it will ultimately return because that underlying cause is not being addressed.
Okay. And how are you? I mean, obviously the underlying cause is common, but there's so many different ways to treat it. And do you treat it so differently based off of the person?
Yes, but I'd like to maybe address that question a little later on. But I would like to also talk about insomnia and sleep,
Okay.
because that
Yeah.
is becoming a more and more common issue with patients. And what I find when I ask them is that they will go to bed and may lay there for an hour or two awake with their mind racing, thinking about events that have happened during the day or worrying about what's going to happen in the future.
Mm-hmm.
And this stress causes them to have problems falling asleep, but also it can cause them to wake up in the middle of the night multiple times, and then they lay awake in the middle of the night, not able to go back to sleep because their mind is racing. So anxiety stress affects our body in a multitude of ways.
Right. Well, I noticed in your comments in their notes, you also have adrenal glands in there. And that's a big role that people aren't really addressing or looking at and taking care of either, is our adrenals.
Correct. A lot of times, and this affects our energy. And like I said before at the beginning, fatigue is probably the most common symptom I see in patients. And the fatigue could be caused either by thyroid dysfunction or by our adrenal dysfunction, or a combination of both. What stress affects our adrenals. Our adrenal glands produce and release cortisol in response to stress. And then this hormone triggers the body's flight or fight
Mm-hmm.
response. And you can imagine someone who is constantly under stress eventually drains the adrenal glands and its ability to produce cortisol. This can be analogous to someone whipping a horse, to the point to where it just cannot run any longer and just collapse.
Mm-hmm.
And this is what happens to our adrenal function. And it's this cortisol that can help with energy.
Well, do you recommend taking, I mean, how do you take cortisol? Like, what do you do to stimulate that cortisol?
Well, first of all, you need to address the underlying cause, which is the stress and anxiety, and then help rebuild the adrenal using specific supplements. And sometimes if someone's adrenals is so exhausted, we'll give them a bioidentical form of cortisol so that the adrenals can rest and begin the healing process. The adrenals don't feel like they need to produce the cortisol because we're providing that. And after a period of 2 or 3 months, once the adrenals have healed, then we can take them off this bioidentical cortisol.
I'm guessing you make that in the compounding pharmacy you guys have?
Yes.
Okay. And what I see that you have some notes on here about psychotropic medication and OTC medication.
Well, yes, because many people today resort to seeing a psychiatrist or use over-the-counter medications to address these health issues like insomnia, anxiety. But what I have found that there are really three therapeutic modalities that can actually cure this underlying anxiety and stress. And as a result of eliminating the anxiety stress, they don't experience all these health issues that we've been talking about. One therapeutic way of treating is with homeopathy.
Mm-hmm.
And homeopathy is really different from any other type of alternative therapy in that it looks at restoring the balance at a very deep level on an emotional, physical, and mental level. And probably the most really dramatic example of the use of homeopathy is the use of it in treating PTSD. In 2017, there was a horrific mass shooting that occurred at the Route 91 Harvest Festival in Las Vegas.
Mm-hmm.
And about 6 to 9 months after that, I had 4 to 5 patients come in experiencing PTSD from their experience at being at this concert. Basically, their body was in a constant state of alert, and any loud noise would trigger a startle reflex.
Mm-hmm.
And some of these patients were even startling awake at night from nightmares of the shooting. And what I found is that when I treated them with a homeopathic remedy of aconite, that their PTSD symptoms went away and stayed away. They were sleeping through the night and they were not startling like they were before. In fact, I've treated Vietnam vets that were having PTSD, and we know Vietnam occurred in the 60s. And when I would treat them with this homeopathic remedy aconite, their PTSD symptoms would go away.
Are you doing it at a 30C or high dose?
We use a high potency in treating PTSD.
Okay.
So, this is one example of how homeopathy can put the body back in balance on this emotional level. Another therapeutic modality that we use is acupuncture. And I would say this is the next best treatment for anxiety and stress and the symptoms that result from this. And it works just as homeopathy works at an energetic level. The Chinese discovered over 2,000 years ago that by putting needles in specific points, it can help balance this yin and yang energy. And what a lot of people don't realize is that during the day, you want your yang energy to be manifesting. This is what keeps you awake and alert. But at night, you want the yin energy to begin to suppress this yang energy so you can quiet your mind, you can go to sleep and stay asleep. So with acupuncture, we can rebalance this yin and yang energy.
Mm-hmm.
So this is very often works really well with issues of insomnia, but also fatigue and digestive issues.
So basically, it's stimulating the body to heal itself, homeopathy and acupuncture. And
Correct.
it's a very old form of healthcare long before the American Medical Association. So there's got to be
Right.
some truth and validity to it, obviously, if it's
Right.
still working and been around for so long.
Yeah. Homeopathy had its origins in the 1830s. And for it to survive, 100 plus years, there had to be some truth to it.
Mm-hmm.
Otherwise, it wouldn't be around. The same with acupuncture. It's been around for over 2,000 years. And it survived because it works.
Mm-hmm. And are you seeing a surge in people coming to see you for these treatments and these types of modalities because they're starting to see value in it?
Most people are not aware of homeopathy. They're much more aware of acupuncture today. Um, so people are coming to me seeking help for the symptoms that we talked about, and
Uh-huh.
then I will introduce them into homeopathy. And then once they experience how dramatic of effect it can have on their health, they, become converted and realize that there are other systems of medicine that can benefit them.
Mm-hmm. Well, the interesting thing about homeopathy is that it is using all sorts of natural resources around us from Mother Earth. And then it is turned into the most minutest form where when you test a homeopathic remedy, you can't even find a trace of the actual element. However, it holds the energy of it. And so it seems like a lot more people are becoming a lot more aware of energy work per se, like even with Reiki and stuff like that. So I think they're able to comprehend how homeopathy works a little bit more. Would you say that?
Uh, yes, and I think the internet has played a big part in alternative medicine in general becoming more accepted among the lay people.
Mm-hmm.
Um, but with homeopathy, the remedies are made either from the plant, animal, or mineral kingdom. And like you mentioned, they're given in a very dilute form to stimulate the healing. Each substance, each homeopathic remedy has a unique electromagnetic property. And it's that electromagnetic property of that substance that is triggering, that is resonating with the patient's body energy to stimulate healing. Um, and so it's very specific in its treatment. And I think why Western medicine has a hard time understanding homeopathy is because they don't realize that there is this energetic aspect to the body and that it can be manipulated and can be rebalanced.
Mm-hmm. It's pretty cool when you think about it and how it's used to treat the body. And obviously, I grew up with homeopathy and have experienced incredible benefits from it. The one thing that I've noticed about acupuncture is within the first couple of treatments of acupuncture, I think the best side effect that ever happens is that you get into this natural circadian rhythm and you just start to fall asleep at a natural time and you wake up at a natural time and it's not, and it does, and you just like start to feel more balanced in your energy level. Would you say that's what are common things that your patients are seeing when they first start getting treated with acupuncture?
For sure. And that's what we're trying to do is just balance this yin and yang energy. And once it's balanced, it will tend to stay in balance. And it doesn't matter whether we balance it with homeopathy or with acupuncture. It'll stay in balance as long as we're not re-exposed to some stress, chronic recurring stress. So some people may need to have a quote tune-up every month just to keep their body in balance. Because today we tend to live in a much more stressful situation than I think we did 100 years ago.
Mm-hmm.
And so we need to be balanced on a regular basis.
Well, we're constantly being barraged and stimulated by uh, stuff like dingings on our phone, alerts, notifications, and then there's all the screen time, and that I think throws our body into fight or flight also, wouldn't you say? It's a heightened alert constantly.
Right. Correct.
So how long have you been practicing, Dr. Pfau?
Well, I started in 1986, so almost 40 years.
And what have you seen transition and shift with your practice, with patients coming in and things that you've needed to expand in your practice with?
Seeing, well, when I first started practicing, patients' health issues were more simple to treat. Nowadays, they're becoming more and more complex. And I think it has a lot to do with the genetically modified food we're exposed to, the chemical environment we're exposed to, the electromagnetic environment, like Wi-Fi that our body is exposed to, and just the level of stress.
Mm-hmm.
Um, so patients are becoming more complex to treat. And also, COVID kind of brought about a shift in people's health, making it more difficult to treat. This would be either exposure to the virus or to the vaccine. But I'd like
Fascinating.
so we've talked at this point about homeopathy and acupuncture,
Right.
helping to rebalance anxiety and stress. Um, about 6 years ago, I was at a ozone conference. I overheard a doctor mentioning a Dr. Walsh, and that how he was treating anxiety and stress. And so I looked him up on the internet and decided to take his course in Chicago.
Mm-hmm.
And I've taken several of his courses over the years. And what I found is that when I was using homeopathy and acupuncture, I could successfully treat about 80% of patients' issues with anxiety and stress and to bring them back into balance. But there's always this 20% that no matter what I tried, I had no influence. Once I began to use Dr. Walsh's approach in treating anxiety, I found that I would say 80% of these people finally responded. It was kind of the key that unlocked what they were missing in balancing their body. What's unique about Dr. Walsh is that he's a PhD, but he's been practicing medicine for the last 30 years. And he first began studying inmates on death row, looking at their urine and blood to see what was it that was out of balance that could have triggered them to cause such, gross crimes. In fact, one of his inmates that he studied was Charles Manson. And he found that these inmates lacked or had an imbalance in their zinc and copper. And as he tried treating these inmates, but he found because they were always using drugs, it became very difficult to get good results. So he expanded his practice to more people outside the prison situation. He began treating children and adults balancing the zinc copper issue. And he found dramatic results. And as I applied this to my patients, I found that oftentimes people had this imbalance in zinc copper that resulted in their causing anxiety and which in turn caused them to stress more than what they needed to.
Are you finding that there's particular types of people? I mean, I feel like redheads typically have more high copper count, wouldn't you say?
I find it's more related to blood type.
Okay.
People with type A blood consistently have a low zinc. And as a result of this zinc being low, their copper is high. So that's the most common thing I find with people with anxiety. But people with type O blood, which is the most common, or AB, they also can have an imbalance. But it's type A blood that consistently have a imbalance often. But what's interesting is some people can have very high copper levels, and yet they experience no issues with insomnia or anxiety. So again, it doesn't apply to everyone, but I would say the majority of people, if their zinc and copper is out of balance, by restoring this balance, they emotionally will feel a significant improvement.
So what you're saying is if you're going to treat a patient with homeopathy and acupuncture, but if you're not seeing any improvement with their stress or anxiety levels, you're going to do a specific blood test to see what the zinc and copper levels are at, correct? And then treat them in that fashion?
Mm, well, currently what I do, if someone comes in with anxiety and stress and the symptoms related to it, I will treat them homeopathically. I will refer them to Dr. Renee Haldeman for acupuncture, and then I will test their blood for zinc, copper, and something we call ceruloplasmin, a protein that binds to copper. And then also there's a urine test that looks at pyrroles. I'll run tests on patients if I feel they have symptoms related to pyrroles. So I try to address their emotional imbalance with all three areas.
And you're seeing success with that. And what is the
I would
time frame of
say
improvement?
I would say 95% of patients respond dramatically. With with homeopathy, we will tell them for every year they've been in a state of imbalance, you're looking at a month for the body to heal itself. Usually, I'll see 30% improvement with homeopathy the first month, another 30%, and on until finally, once they're in balance, they no longer need to be treated homeopathically. Acupuncture, I find, works more quickly. Usually within 3 to 4 treatments, they're seeing 30% improvement.
Mm-hmm.
And so, they can be a little bit more patient with the homeopathic remedy and what it's doing. When we treat them for their zinc copper imbalance, if they are type A blood, it can take 6 to 9 to even 12 months for that to become balanced. If they're not type A blood, they'll become balanced within 2 to 3 months.
That is amazing. So how do we get the word out and tell people this podcast?
Well, the majority of our patients come to us by referral from other patients. So that's one way. But like I said, today more and more people are searching the internet looking for solutions to their health problems. They are tired of taking medications that have side effects and don't really cure, but only suppress. And so they're searching the net looking for solutions. But let me add, Western medicine does have its place. There will be a certain small percentage of patients that don't respond to what we do as alternative medicine. And in that instance, I feel Western medicine, psychiatric medications can be effective and should be used, but it should not be the first thing that patients resort to.
Mm-hmm. Okay. And that's how you approach your practice as well, because you are a doctor of osteopathy. So you can write prescriptions, but you always opt to do that as a last resort.
Correct. I myself do not prescribe psychiatric medications. If a patient is not responding to what I have treated them with, I will refer them to a psychiatrist.
Okay. Any other words of advice for this last minute of our podcast?
I think for some patients, seeing a psychologist can be of benefit in that it makes them more aware of what could be triggering their anxiety, and it helps them to, quote, manage their anxiety while we're trying to cure their anxiety. So there's a big difference. I feel a patient long-term should not have to manage their anxiety. They just should not experience it.
Mm-hmm. Well, I think a lot of people don't even know what natural or balanced healthcare or well-being even looks or feels like for themselves, wouldn't you say? So it's just like educating people on how a body is supposed to operate healthily.
Well, when they've been in a state of imbalance most of their life, they don't really know what it feels like to be balanced. And I hear this a lot when I treat patients. for example, someone that's been constipated their whole life, going once a week, they feel that's normal. But once we correct that, to where they go every day, then they realize what is normal.
Mm-hmm. And same with sleep and all of that.
Right.
Yeah, that's really amazing. Thank you, Dr. Pfau, for coming on. And
All right, you're welcome.
we need to do this more often.
Okay. Yeah, well, I'm not a big fan.
I know. This
has been the Healing the Whole Body podcast from the Renaissance Health Center in Las Vegas. Visit us at iwholehealth.com. That's the letter I, wholehealth.com. Here's to a vibrant, healthy, productive life.
This has been a production from a podcast studio.